Here's a detailed, organized answer for clonidine. 1. Generic name, drug class, brand name. Generic name, clonidine. Drug class, centrally acting alpha-2 adrenergic agonist, antihypertensive agent. Brand names, Catapress, oral tablet, Capve, extended release tablet for ADHD, Duraclon, epidural injection. 2. What is clonidine? Clonidine is a medication that lowers blood pressure by decreasing the levels of certain chemicals in the blood, which allows blood vessels to relax and the heart to beat more slowly and easily. It is also used for ADHD, withdrawal symptoms, and pain management in certain cases. 3. Primary indications: hypertension, high blood pressure, attention deficit hyperactivity disorder, ADHD, extended release formulation. Other uses: off-label or additional, management of withdrawal symptoms, opioids, nicotine, alcohol, anxiety disorders, pain management, especially cancer-related pain with epidural use. How to 4. Contraindications: hypersensitivity to clonidine or any component of the formulation, severe bradyarrhythmias, very slow heart rhythms, patients with certain heart conduction problems, e.g. sick sinus syndrome without a pacemaker. 5. Before taking this medicine, precautions: tell your doctor if you have heart disease or circulation problems, history of stroke, heart attack, low blood pressure, hypotension, kidney disease, depression or mental health conditions. Do not stop clonidine suddenly. Rebound hypertension can occur. 6. How to use: take exactly as prescribed by your doctor. Swallow tablets whole. Do not crush or chew extended release tablets like Capve. Consistent daily schedule is important. If using the patch, Catapress TTS, apply to a hairless area of skin and replace weekly. 7. Dosing information: hypertension, oral tablet, typically starts at 0.1 milligrams twice daily. Dose may be adjusted every week based on response. ADHD, extended release Capve, start with 0.1 milligrams at bedtime. Gradually titrate up by 0.1 milligrams per day increments weekly. Transdermal patch, typically changed once weekly. Always individualized dosing per patient needs. 8. Miss a dose, overdose. Miss dose, take as soon as you remember. Skip if it's almost time for your next dose. Do not double dose. Overdose symptoms: severe drowsiness, slow heart rate, shallow breathing, weakness, cold or clammy skin, potential coma. Emergency: seek immediate medical attention if overdose is suspected. 9. Stop or avoid taking. Do not stop clonidine abruptly. Risk of severe rebound hypertension, stroke, or heart problems. Always taper the dose under doctor's guidance if discontinuation is needed. SNARS 10. Side effects common: dry mouth, drowsiness, dizziness, constipation, fatigue. Serious: slow heart rate, bradycardia, severe hypotension, low blood pressure, heart block, depression, hallucinations. HESHRA 11. Other drugs will affect clonidine. Drugs that increase sedation: alcohol, benzodiazepines, opioids, sleeping pills. Other blood pressure medications can increase risk of hypotension. Beta blockers, if used together, clonidine should not be stopped abruptly, can cause dangerous blood pressure spikes. Antidepressants, TCAs, may reduce clonidine's effectiveness. Thank you. Have a nice day.